I became a doctor because probably I grew up around it. So my father is a vascular surgeon. My grandfather was a surgeon, his father. So I can remember when I was 5 or 6 years old, my grandfather would make house calls to his patients, and I would carry his black bag with him and go visit the patients. And then when I was in high school, I started to scrub in and watch my father do operations. And so I was exposed to it at a very young age. I saw sort of the gratitude and the joy that taking care of patients gave my dad and my grandfather. And I wanted to do that too. I like being a doctor, so a lot of surgical specialties, you're more of a proceduralist and you don't do a lot of actual medicine. And I like vascular patients usually have medical comorbidities, and you're able to sort of practice the art of medicine as well as the art of surgery. We're a full scope vascular surgery practice, so any vascular patient that has any issues we can handle from a surgical standpoint, a minimally invasive endovascular standpoint, and a medical standpoint. So we can be a one-stop shop for all patients with vascular disease. Something that might surprise people about me is probably two things. One is I like to listen to old school hip hop music in the operating room because it gets me jazzed up and ready for doing the operations. And the second thing is that my wife is from Italy, from a small island called Sardinia in Italy, and when I decided I was going to ask her to marry me, I had never met her parents, and so I flew 22 hours from Baltimore to Italy to ask her father's permission to marry her in a very broken Italian, and then came back and told my wife, and I didn't tell my wife I was going on the trip, so it was a big surprise for her.